Good evening everyone, this is Dr. Murali from India. Today I want to explain the topic mucormycosis. See, this mucormycosis is very notorious. These patients die in hours sometimes. So I don't take a chance for decrease of this RBS to operate this patient. My policy is the second I see the patient, I will operate. The minute I see the patient, I will operate. Which means, even if the RBS is not decreased, I don't bother. I will take the patient to the OR, even without, not even general anesthesia, even without local anesthesia also. Even without keeping 4% gelatin also, you can debride these mucormycosis cases. Most of the nerve endings are gone. So you just debride it. Even under local, even there is no need of even 4% gelatin also sometimes. If at all some pain is there, you can locally infiltrate or you keep 4% mops and then debride it. So don't wait for decrease of RBS. Most of these patients are diabetics and their sugars are in 300, 400s. So don't wait for 1 or 2 days for decrease of these sugars. Suppose if you encounter an accident patient, will you wait for decrease of sugars? Suppose if you encounter a diabetic patient with multiple fractures, will you wait for the decrease of sugars? What you will do in the OR, emergency OR? You will keep 5% dextrose, 5%, 5 units of insulin, and you will keep the anesthetist will manage that. Don't bother about it. The anesthetist will take care about the sugars. So they will keep a drip, 5 units in 5% dextrose, and they will keep a drip. That is the headache of the anesthetist. Don't bother about it. So debride it immediately. Most of these patients have orbital cellulitis and ophthalmoplegia, and there is impeding cavernous sinus thrombosis, or sometimes there is clear-cut thrombosis also. So don't wait for the decrease of these sugars. That is the message I want to give. The second you see this case, you operate this case. The minute you see this case, you debride this, thoroughly debride until you get the bleeding points. I have operated so many cases without even giving 4% gelatin also. In the corridor of OT also, what all needle is, you just debride it. That's it. Most of these patients, they come in Saturday evenings and Sundays. These patients, they will die because we will wait for Monday. In the meantime, they will succumb. So even Saturdays also, Sundays also, any day, if you see the patient in the evenings, at the night also, you operate in the midnight. This is an emergency. Don't think that you can do after decrease of RBS and you will post that case in the regular OTs and do the cases. Don't do that. That is the mistake, biggest mistake we ENTs are doing. So many patients are dying. The minute you see, the second you see, you operate. There is no need of general anesthesia. There is no need of even local anesthesia also. Even how will you identify myocarditis? If you keep an endoscope, there is black scar. What Dr. Satish Jain says is, if there is immunocompromise like diabetes or HIV or any other thing, if the middle terminate is even rubbery also, you cut it. That is the message Dr. Satish Jain is giving. So debride. Don't waste time. And you completely, if the disease extended to the cavernous sinus also, you remove this mucor from the cavernous also. So you just follow the disease and you will surprise. Most of these patients will survive if you debride immediately, damn immediately. That is the message I want to give. In some patients, when you keep an endoscope, you may not find the mucor, black scar. Even then, if it is very severe and if there is ophthalmoplegia or orbital cellulitis, when there is impeding cavernous sinus thrombosis, even then you operate immediately. So the don't waste time. Don't waste time. Suppose if you waste time, suppose if these patients land up in cavernous sinus thrombosis and there is unconscious or semi-conscious, even if you manage in ICU setups also, they will not survive. So the trick, the key point is, the minute you see, you operate it. Even at midnight also. This is the very case we have to operate at midnight also. This is the final message I am giving you. Thank you. Okay. Another point what the ENT surgeons may think, in my view, mistakenly is, surgeons are thinking that by giving amphotericin B or some posaconazole or something, antifungals, we can delay 1 or 2 days and let us see the response. No, I don't believe in that. This medical treatment is never replacement for our debridement. I feel debridement is the first thing which has to be done. I mean, you can do the simultaneously, but debridement has to be given highest importance. Our amphotericin B or posaconazole or any medical treatment, it has to be afterwards only. So what I believe is the prime treatment must be debridement. Wherever it goes, even if it goes into cavernous sinus also, even if it goes into the pituitary, brain also, you follow the tuba and debride. I saved so many patients. Believe me. Thank you.